Now, if you live with a chronic snorer or you are one yourself, you probably haven't had a good night's rest in a long time. But there is a procedure that can help. Here with all the details is Dr. Brian Dorfman from the Center for Oral and Facial Surgery in Anthem. Good to see you, Dr. Dorfman. Thank you for joining us. First of all, why do people snore?
Well, the biggest reason for snoring itself is your soft palate, which is the back part of the roof of your mouth. It tends to get relaxed. There's a muscle layer in the soft palate, and as that area relaxes and air passes over and under it as you breathe through your nose and through your mouth, what happens is that the palate vibrates, and when that vibrates, you get the snoring sound. I like to compare it to if you took a piece of paper and put it between your lips and blew on it, you get that high-pitched noise. But if you tighten that, you don't get that high-pitched noise anymore.
I see. And that's what we were looking at, the pictures of that soft palate kind of dipping down so that you get that ruffling effect.
Right. As you sleep, that soft palate, if it's very relaxed, will dip towards the back of the throat.
And we were talking earlier, the snorer is impacted, but the person who's sleeping with the snorer, or your spouse, whatever, is really impacted.
Absolutely. And that's where most of the patients come to the office, because of the partner making a suggestion to come and take care of this issue. And what happens is patients, partners that don't get rest, they have hypertension, they have stroke issues, they have heart disease, and as well as we know, intimacy problems, and that has a hard impact on most people's lives. And a lot of people aren't really aware of these procedures that we can do today to take care of it. And there really is no compliance issue involved with this procedure, which makes it so great, whereas other oral devices that people wear at night to help stop them sleeping, you have to wear it, and it becomes uncomfortable, and they usually wind up on people's nightstands.
Right.
That's why this procedure actually works out a little bit better.
Well, let's talk about it. It's called the pillar procedure?
Yes, it is.
And what is it exactly?
The pillar procedure is it's a technique where we place small polyester implants.
Are we talking about these right here?
Yes, that's exactly the size. So you can compare the size of this to the tip of my finger. They're only 18 millimeters in length, about the size of a dime. Now, it's a polyester material which has been used in the fabrication of sutures that we use throughout the body, for the last 50 years. These three, when we place three of them in the palate, what happens is we place them close together so that we get scarring, a natural body reaction to any foreign material. When you have stitches placed in your body, it forms scar. What happens is with this procedure, we actually get an initial stiffening of the soft palate. Okay, so you actually have some relief right away. Most of our patients will tell us at the post-op appointment the following week that their partner's already ecstatic because they have stopped snoring or it's been greatly diminished. But the procedure really is designed to work over about 90 to 120 days. That's how long it takes the body to form the scar tissue. You won't realize these are in your palate. You don't feel them, you don't see them. They're in the muscle layer. And it's done under local anesthesia in the office. It takes about 20 minutes for the entire procedure to be done. Most of my patients are back at work that day. Their normal activities that day. Go about your lives the next day.
Have you noticed comments from either themselves or their sleeping partner that they're sleeping better?
Yeah, absolutely. And a lot of the patients that have mild to moderate sleep apnea along with this tend to get relief of the sleep apnea, so they're not as tired during the day. They don't use as many, they don't have to drink as much coffee, they're not drinking as many energy drinks. And it is FDA approved for mild to moderate sleep apnea, but the best relief really is from the snoring, and unfortunately, since Medicare and the insurance industry considers snoring a social issue or a cosmetic issue, most of the time it's not covered by any insurances. But with sleep apnea, if sleep apnea is a diagnosis, that can help.
Well, can you imagine? I mean, people probably don't even realize how sleep deprived they were because they didn't really understand what the snoring was doing. That's a pretty quick fix, and who knows all the benefits you'll get from it.
Right.
Thank you, Dr. Dorfman. Very interesting procedure. So,
thank you.
If you want more information on how to stop those days of snoring, those nights of snoring, I should say, or if you want more information on the pillar procedure that we just talked about, of course, go to the Center for Oral and Facial Surgery at Anthem. Go to their website, stopsnoringaz.com or drbdorfman.com for all the information. Thanks again.
Thank you.